What are high knees?
High knees are a dynamic cardio exercise where you run in place, lifting your knees as high as possible with each step. This movement raises your heart rate, challenges coordination, and strengthens your lower body. High knees are popular in warm-ups, circuit training, and interval workouts, offering both aerobic and muscular benefits in a short burst of activity.
How to perform high knees correctly?
Start by standing tall with feet hip-width apart. March or jog in place, quickly driving one knee toward your chest while pumping the opposite arm. Alternate knees rapidly, landing lightly on the balls of your feet. Focus on keeping your core tight, chest up, and back straight. Aim for smooth, controlled movements rather than speed at first, gradually building intensity as you master the technique.
Mastering proper form.
Good form is essential for effective and safe high knees. Keep your torso upright to avoid leaning forward or backward. Drive your knees to at least waist height for full benefit, and keep your arms actively engaged. Relax your shoulders and avoid tensing your upper body. Maintaining proper alignment helps prevent strain and ensures you're working the intended muscle groups.
Breathing and rhythm tips.
Coordinate your breathing with your movement. Inhale gently through your nose as you prepare, and exhale through your mouth as you lift each knee. Try to maintain a steady rhythm, even as the movement is fast, so your breathing doesn't become erratic. Consistent breathing improves your endurance and helps you focus, making high knees more enjoyable and sustainable.
Injury prevention and safety.
To reduce the risk of injury, always warm up before doing high knees. Wear supportive shoes and choose a flat, non-slip surface. Avoid locking your knees and land softly to protect your joints. Start at a pace suited to your fitness level and gradually increase intensity. Stop if you feel pain, especially in your knees, hips, or lower back, and consult a professional if needed.